privacy. Hi, my name's Audrey. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Lindsay, 12/9/2004.
Okay, so today we're just going to be doing a head-to-toe assessment, if that's okay with you?
Mm-hmm.
Okay, so starting off, I'm just going to inspect your face. Your facial features are symmetrical. Your nose, specifically, is also symmetrical. It's midline. There's no inflammation, deformities, or lesions present. I'm going to go ahead and palpate, if that's okay.
Mm-hmm.
Any tenderness?
No.
Okay. The frontallary sinuses, any tenderness?
No.
And then maxillary, any tenderness?
No.
Okay, so no tenderness and no masses. That is good. I'm going to move on into looking at your lips. The lips are pink, they're hydrated, moist, there is minimal cracking and no lesions. I'm going to have you go ahead and open up your mouth and stick out your tongue. Okay. So the pharynx is pink and moist. Can you say ah for me? Okay. The uvula is pink, moist, and rises with phonation. The tonsils are grade 1, barely visible, pink and moist. I'm going to have you lift your tongue to the roof of your mouth. Okay. Looking at the floor of the mouth and the buccal mucosa. They are pink, moist. There is no masses, lesions, or inflammation present. Can you stick out your tongue for me? Okay. The tongue is a nice beefy pink, which is appropriate. There's no masses, inflammation, or lesions. That's good. Okay. I'm gonna have you smile. Okay. All of the teeth are present. They are clean. There is no plaque and no visible dental caries. And then can you kind of like, yes, thank you. Okay. The gums are pink and moist. There are no masses, no visible lesions. They adhere to the teeth well and don't appear to be descending or off the teeth. So that is good. Okay. I'm gonna go ahead and now we're gonna do more focus on your eyes. So previously we tested your distant visual acuity using the Snellen chart. You were able to read you were able to score a 20 out of 20 with the left eye, the right eye, and both eyes together with visual aid because you have contacts, correct? Yes. Okay, and then we also tested your near visual acuity using the Rosenbaum chart. You were able to read from 14 inches away with the left eye, the right eye, and both eyes. And both those tested with your contacts and again, so with visual aids. Both the Snellen chart and the Rosenbaum chart tested cranial nerve 2. So now I'm going to go ahead and I'm going to test your extraocular eye muscles with the 6 cardinal fields of gaze. You can look at the tip of my pen light and just follow them with your eyes. Okay, the 6 cardinal fields of gaze are intact. There was no nystagmus. That tested cranial nerves 3, 4, and 6. So I'm going to go ahead and just take a closer look at your pupils and eyes. The pupils are both 7 millimeters in diameter. They were both equal and round as well. I'm going to shine a light into one pupil at a time. Okay. They reacted to light, and then just follow my pen light with your eyes again. Okay, and they accommodate. So Perla is intact, and that tested cranial nerve 3. So now just inspecting your eyes. The sclera is white. The irises are a blue-green color, and it is an even coloration on both eyes. The cornea is smooth and clear. Can you pull down your lower eyelids for me? Okay. The conjunctiva is clean and pink. You're good to let go. So the eyelids are intact. There is no edema, no lesions, masses, or inflammation, both upper and lower eyelids. The eyelashes are evenly distributed on both upper and lower lids. The upper lids curl up and out. The eyebrows are also evenly distributed and symmetrical, so that's good. I'm going to go ahead and apply some gloves to palpate your eyes if that's okay. Just You can close your eyes. Starting with the lacrimal apparatus, any tenderness?
No.
Okay, so no tenderness and no drainage. The upper eyelids, the lower eyelids, any tenderness?
No.
Okay, and so no tenderness and no masses. Now your eyebrows, any tenderness?
No.
Okay, and then the bony orbit. Any tenderness?
No.
Okay. So no tenderness and no masses felt, which is good. Okay, now taking a look at your ears. The tops of the ears are aligned with the eyes. The ears are pink and white, appropriate for your ethnicity. There is one lesion in each earlobe from a piercing. There doesn't appear to be any masses or nodules that are visible. I'm going to go ahead and take a look into your ear canal. Okay, so the ear canal is clean. There's no drainage, no inflammation, and no foreign bodies. And the other ear. Okay. This ear canal is also clean. There's no drainage, no inflammation, no foreign bodies. That's good. I'm gonna go ahead and palpate your ears, okay? Let me know if you have any tenderness. So the external ear, and the tragus, and then the mastoid process. Any tenderness?
No.
Okay, so no tenderness and then no masses and nodules felt, so that's good. So I'm gonna have you, I'm just gonna go behind you and I'm going to do a hearing test. Raise your hand which side you hear it on, okay? So I'm gonna do small ones. Okay, so hearing is intact in both ears. That tested cranial nerve 8. Okay, so now we're going to be moving on to more of a focused skin assessment. So looking at the skin on your arms, it is white, it is appropriate for your ethnicity, it appears to be well moisturized, it's intact and it's clean. I'll go ahead and feel it with the back of my hands. The skin is warm on the upper extremities. It was smooth in texture and I also had no masses or nodules felt. I'm just gonna also palpate, check for any edema. Any tenderness?
No.
Okay, no tenderness and no edema either, so that's good. So, looking at, I'm gonna take a look at your hands. Okay, looking at the fingers. The fingernails are smooth, they're round, they're clean, they're pink in color. I'm gonna do capillary refill. Okay, capillary refill is brisk, less than 2 seconds, and you can go like this for me. Okay, no clubbing, so that is good. Okay, so now on your lower extremities, the skin is also white. It is intact, it's clean, it's well moisturized. I'm gonna feel. Okay, it is warm, and then any tenderness?
No.
Okay, no tenderness, and the texture is smooth, so that's good. Okay, so I'm gonna also take a look at your hair now. The hair is a dirty blonde color. It's kind of straight with a little bit of waves. It's soft, it's fine. I'm gonna check behind your ears. Okay, and then the nape of your neck. And then this other ear. Okay, no parasites, so that is good. I'm gonna be taking a look at your going now. It's symmetrical. There is no visible scarring, lesions, masses, or any deformities, so that's good. So I'm gonna check capillary refill on your toes really quick too, sorry. Okay, capillary refill is brisk. The toenails are also round, they're smooth, they're clean, and they kind of have a bluish, a little bit of a blue color, but capillary refill is good, so that's okay. Okay, so now I'm going to be moving on to a bit more of the central vascular assessment. So just taking a look right now at your carotid arteries, they are symmetrical. There is no abnormal pulsations or bulging. I'm going to listen, and I'm going to apply light pressure with the diaphragm to stimulate the valve. I'm going to have you turn your head and look away from me and hold your breath, okay? You can breathe normal, and then I'm going to have you turn this way, and then you can hold your breath again. Okay, there was no carotid bruit, so that's good. Now I'm just going to palpate your carotid pulses. Just one at a time. Okay, so the carotid pulse had an even and smooth rate and rhythm, a +2 strength, which is good. So now I'm going to go ahead and take a look at your chest. The chest is, the skin is intact, it is clean, there are no visible pulsations. I'm going to go ahead and palpate. Any tenderness?
No.
Okay, so no tenderness, no masses or nodules, and no pulsations felt. I'm also just going to palpate down here. Sorry. Any tenderness?
No.
Okay, no tenderness, no masses, and no pulsations felt. That's good. Okay, so I'm going to go ahead and I'm going to listen to your heart. I'm going to first listen with the diaphragm, applying some pressure, and then light pressure for the bell. Okay? Okay, so starting with the aortic. And the pulmonic. And the Erb's point. Okay, I'm sorry. Okay, the tricuspid. Okay, and then I'm going to go up and under for the mitral. Okay. So the heart rate was even and smooth in all 5 points. There were no additional sounds heard and no murmurs. S1 was loudest at the apex, S2 was loudest at the base. Previously, I did listen to your apical pulse at the mitral spot for a full minute, and you had a heart rate of 67 beats per minute, which is normal, it's good. Okay. So now I'm going to be moving on to just doing more of a respiratory assessment. So just looking, you have even and unlabored breaths currently. The chest is moving symmetrically, left and right side together. Your face, there are no signs of cyanosis around the lips or on the tips of the nose. Your face is relaxed, you're sitting in a relaxed position, no tripoding, no signs of respiratory distress. I'm gonna ask you a couple of questions, okay? Can you tell me your name?
Lindsay.
Can you tell me where you are?
Theta.
Can you tell me what month it is?
April.
And do you know where you're here?
For head to toe assessment.
Okay, so alert and oriented ×4, so that's good. Okay, now I'm just examining the chest. The chest is an elliptical in shape. The AP to transverse diameter is 1 to 2, which is normal. I'm going to go ahead and get the costal angle. It's less than 90 degrees, which is normal again. That's good. Okay. So I'm going to go around and I'm just going to palpate the back. Let me know if you have any tenderness while I do this. No tenderness?
No.
Okay, so no tenderness, no masses, no nodules. The posterior chest wall was stable. So I'm going to now go ahead and listen to your breath sounds. Each time I place my stethoscope, you can take a deep breath in and a deep breath out. I'm going to come down here. Okay. The anterior lung sounds were clear to auscultation in all lobes bilaterally. I'm going to go ahead and listen to your back. So you can do the same thing. Take a deep breath in and out every time I place my stethoscope. The posterior chest sounds, lung sounds were clear to all cessation in all lobes bilaterally. So I also didn't hear any adventitious sounds. Some common ones are wheezing, which is more like high-pitched music notes, and then crackles, which can be lower or higher pitched, but it sounds like popping noises, but there's none of them, so that's good. Okay, so now I'm going to move on to your peripheral vascular assessment. So again, just going back to the arms. The arms have even coloration. There's no discoloration. The skin is intact. It's clean. It's dry. I'm going to go ahead and feel. It's warm. Any tenderness?
No.
Okay, no tenderness and no edema. And then I'm going to go ahead and have you go like this, just on resting. Yes. Okay. I'm going to feel for your radial pulses. Okay, so there's an even and regular rate and rhythm, bilaterally, a +2 strength bilaterally as well, and now your brachial pulses. Okay. Even and regular rate and rhythm, +2 strength bilaterally. Now we're going to go ahead and just take a look at your legs. The legs are symmetrical. There is no discoloration, no varicosities, no ulcers. The skin is all white. Hair is covering, hair seems to be evenly distributed. Go ahead. Any tenderness?
No.
Okay. The skin is warm. Okay, and then I'm going to feel for some pretibial edema. Just none. And then some malleolar edema. No malleolar edema. Okay, so I'm going to feel your femoral artery. I'm sorry, it's a bit invasive, but over your shorts. Okay, so the femoral artery was had an even and regular rate and rhythm, +2 strength bilaterally. I'm going to go ahead and have you scooch forward for me. I'm going to feel your popliteal artery behind your knees here. Okay, so even and regular rate and rhythm, +2 strength bilaterally. I'm going to check your posterior tibial arteries back here. Okay, even and regular rate and rhythm, +2 strength bilaterally. And then can you flex your toes for me? And then your dorsalis pedis pulse. Okay, even and regular rate and rhythm, +2 strength bilaterally. So that's good. Okay, so now I'm going to have you go ahead and lay down. I'm going to be looking at your abdomen. Sorry. By the way, before my hand hygiene. So would you be okay pulling up your shirt just for me? Okay. Thank you. Okay. So the abdomen it's intact. The skin is intact. It is flat. There is no bulging, no pulsations anywhere. The umbilicus is midline. It is inverted. There's no drainage. I'm going to go ahead. And listen, starting in the right lower quadrant. Okay, so bowel sounds were normal active in all 4 quadrants. In order to declare absent bowel sounds, you'd have to listen for 5 minutes in each quadrant and not hear anything, but it's not you, don't worry. I'm gonna go ahead and apply light pressure with my diaphragm to stimulate the bowel and listen for aortic brewery. Okay, no aortic brewery, so that is good. Okay, so now I'm just gonna go ahead and palpate your abdomen. Let me know if you feel any tenderness, okay? Can you bend your knees for me? Thank you. Thank you, thank you. Any tenderness?
No.
Sorry.
Sorry, it just tickles.
I'm sorry.
Very good.
Do you want to put like your hand over mine? Would that make it better?
No, it's okay.
Okay. Okay. Any tenderness anywhere?
No.
Okay, so no tenderness. There were no masses or nodules felt, and then no pulsations felt anywhere either. You also weren't guarding at all, so that's good. If you want to, you can go ahead and sit up now. I'm just going to come behind you and I'm going to check for CVA tenderness. So I'm just going to place my hand on your back and then let me know if you feel any pain, okay?
No.
So no pain, no CVA tenderness. That is good. Okay, so now I'm going to have to look at your musculoskeletal system. Have you had any previous surgeries on your shoulders?
No.
Okay, so just inspecting your shoulders, they are symmetrical. There's no visible deformities, no visible edema, masses, or lesions. I'm gonna go ahead and palpate. Any tenderness?
No.
Okay, so no tenderness and no masses or nodules felt. And then the joint is it's warm. There's no increase in temperature, which is good. And can you move around your shoulders while I hold on? Okay, no crepitus, so that's good. So if you want to, you can stand up. I'm going to bring you through a range of motions. So starting with your arms down for the extension, and then we can go up for flexion, back down for extension, back for hyperextension, okay? And then we could adduct going across, and then abduct going out, and we can circumduct. Okay, so full active range of motion, which is good. Okay, I'm gonna have you shrug up against my hands, okay, and then forward, okay, and then out sideways. Okay, so +5 muscle strength in your shoulders, which is good. Okay, so while we're here, have you had previous surgeries on your hips?
No.
Okay, so sorry, just inspecting like your hips. There doesn't appear to be any deformities. There was no deformities, they appear to be symmetrical. I saw no visible edema or masses or lesions. I'm gonna go ahead and just palpate. Any tenderness?
No.
Okay. I also feel no masses or edema. Sorry, I'm just gonna go ahead. Temperature-wise, they are warm, using the back of my hand, but no increase in temperature, so that's good. I'm just gonna go ahead and have you just kind of like lift up your knees and move your hips for me a bit. Okay. No crepitus felt, so that's good. So now we're gonna bring you through another range of motions for your hips. So just standing like this is extension. I'm gonna have you one leg at a time kick forward for flexion. Okay, and then cross over for adduction. Okay, and then out for abduction. Okay, and then I'm gonna go up and in for internal rotation, and then out for external. Okay, and then other leg up and in for internal rotation, out for external rotation. Okay, good. So now I'm gonna have you do just like one big movement of that for circumduction. Okay, that's good. You have full active range of motion in your hips bilaterally. And then I'm gonna go ahead and just test your muscle strength. So can you just kind of kick this leg out for me? Okay, and this one. Okay, and then out sideways. Out sideways. Okay, so you have full active range of motion and, oops, I said already. You have +5 muscle strain. That's what I just tested. You can go ahead and sit down if you want. So previously, just to go back, because I realized I forgot, I did take your respiratory rate. You do that by watching you breathe when you don't know I'm counting it. For 30 seconds, a full inhale and exhale, and then multiply that by 2. The respiratory rate was 14 breaths per minute, which is normal. And then I'm gonna make sure that you are in a safe and comfortable position, that your call-out would be within reach, and I'm going to do hand hygiene and document my findings.